There you
Okay,
go.
well, let's get started. I'm Paul Clark, the director of the School of Labor and Employment Relations at Penn State University, and I'll be moderating today's webinar. Before we get started, a few housekeeping details. First, a reminder that this session is being recorded and that everything that happens is on the record. Also, each of you out there are asked to click on the Participants tab at the bottom of your screen. This will give you the option to raise your hand. This is one of the ways you can ask a question or make a comment. The other way is to type your question or comment into the chat window, which is also at the bottom of your screen. In both cases, as moderator, I will choose the questions from those posed, giving preference to the order in which they come in. Lastly, we're going to hold questions until the end. There should be plenty of time for Q&A after the speakers use their 5 minutes for their opening comments. The topic of today's LER or LERA webinar is on the front lines in the COVID-19 pandemic, and this topic could not be more relevant. The current crisis we're all a part of has presented the U.S. healthcare system with an unprecedented challenge. And it's probably fair to say that the way we do healthcare in the U.S. will never quite be the same as a result. Today, we want to look at that crisis through the lens of labor management partnerships. We will hear from leaders of the Kaiser Permanente partnership, the longest standing and largest labor management partnership in the US today. We're going to hear from them about how that innovative approach has dealt with the pandemic and its many challenges. And we will also hear from one of the nation's top experts in partnerships in the healthcare industry. With that, let me turn it over to our first speaker, who also just happens to be the national president of LERA, Dennis Dabney. Dennis?
Thank you very much, Paul. Thank you all for tuning in. And I just wanted to let you know that we've decided to relax the rules around masking for this meeting. So although there are a number of people on this virtual conference, you don't need to wear your mask. So, good morning. Jim, Hal, and I thought that we'd give you an overview of Kaiser Permanente and employee unions and how we work together to respond to the pandemic and planning for the expected surge in COVID-19 patients. So with that, I'll turn it over to Jim.
Thank you, and good morning or good afternoon, everybody, depending on where you're hearing this Zoom presentation. I have 3 slides, and my colleague will be moving through them as I cue her. On the first slide, it's a reminder to all of us for personal care for all that's ahead of us as the pandemic still goes. I'd like to add more thought to this too. As I speak to you now, I'd like to speak, I'm sure, for Dennis and also for Hal Ruddick, who will be introduced shortly, in saying that speaking about frontline workers in a crisis like this is very, very important. And we salute those frontline workers who are out there. This week was is National Nurses Week. And as we honor nurses, all of them tell me when I speak up for them in meetings like this, that they are proud to be part of a team of other healthcare workers taking on this pandemic. So these are people who are properly getting recognized and deserve even more recognition. The frontline workers at Kaiser Permanente, but at other places as well. So back to that slide, please, and on to the next one. And on to the next one. One more slide, please.
We're going to show the video, Jim.
Okay, the video's next, and then back to me. Thanks. Thank you for the video, Dennis, and others. A few more comments about our partnership. The unions at Kaiser Permanente represent approximately 162,000 employees. We are in 39 hospitals and about 700 medical offices. In our view, how we come out of this pandemic from a labor relations point of view will be judged on how we've carried out union engagement. Hal Ruddick will give that from the union perspective in a few moments, and how well we maintain job security in a very difficult situation, where around the country, unemployment is rising in a very significant way. Next slide, please. A few words about our labor management partnership. If you Googled us before this presentation, you would know that our labor management partnership has normal stresses and strains that come with modern labor relations. You would know, for example, of tense down to the wire, strike threatened negotiations. You would know that we bargain hard and that the union bargains hard. And you would know that when you hear a presentation about the Kaiser Permanente partnership, that in those occasions, when that presentation reads like a high school yearbook, you know, our team is the best team, you would know that it's actually something different than that. It's humans working together in difficult situations and in tedious situations to deliver healthcare, first of all, and to work together in a consensual, peaceful basis at all times, or at least wherever it's possible. And it's imperfect. If I were to judge our labor management partnership before the handoff in a few moments, I would say that it's got excellent communication vehicles. You saw one that just went a minute long a few moments ago. You could go onto the web and see very good presentations about what we do. But for me, the aspect of our partnership that shines the best and that leads into how we're coping with the pandemic is our frontline teams of frontline workers. We call them unit-based teams. They could be called frontline teams. They could go by various nomenclature. We go by unit-based teams. Now, these unit-based teams are throughout the Kaiser Permanente Corporation, and they do a number of things. It's all around quality, cost, or community involvement. So we have unit-based teams that deal with early detection of cancer, or with working with youth to do gardening, or with working with new parents in neonatal situations to provide for good communications and support groups among the new parents, or working with hypertension in the Mid-Atlantic States region near Washington, D.C. for home monitoring. These unit-based teams have moved forth on quality, and they're taking on the needs around the pandemic. Bernard Tyson, our CEO, his years of date were 1959 to last year, 2019, when he passed away. What he said about the partnership, I'll close with. Mr. Tyson said, "It's nice if we all get along, but the real test is one of results." With that, I'll turn it over to my friend and colleague in this partnership, Mr. Hal Ruddick. Hal.
Thank you, Jim, and I'm glad to see we have so much interest in this webinar today. Let me first just say a little bit about the Alliance of Healthcare Unions that I represent. You saw an earlier slide with all the different unions across Kaiser Permanente. We represent 10 different unions with about 50,000 Kaiser Permanente employees, and we do represent employees in almost every region that Kaiser operates in, from Hawaii to Atlanta and in between. Most of our membership are nurses and other health professionals like pharmacists, physical therapists, but we, depending on the union in the area, we represent all different kinds of unionized workers within the healthcare system. So the first slide here is sort of introductory, and anybody that's been not living under a rock for the last month and a half will understand all of these issues here. So I'm not going to go into them in detail, obviously. These are the same issues that every healthcare worker, healthcare organization is facing across the country. And I would say that I've been involved with Kaiser Permanente since 2013. I've been involved in the labor movement since 1985. And I would say this has been one of the most stressful times for union members that I've ever seen in the history that I've seen at Kaiser Permanente and other settings. The level of concern, justified concern and anxiety over what people were facing in terms of exposure, the challenges around PPE, the planning for a surge at the same time not knowing what might be coming, possibly that could overwhelm the facility. Huge I've never seen such a large dislocation in such a quick period of time, where large parts of the operations were being closed temporarily at the same time that other parts of the operation were being expanded. So in many ways, just as this has been unprecedented for the country as a whole, it has been very unprecedented for the healthcare workforce. So what I'll mainly talk about is what we did in partnership that would be different than the experience that healthcare workers have been experiencing elsewhere across the country. Next slide, please. Thank you. So because of the partnership, we have had a longstanding practice of including unions with Kaiser in operational discussions and not just in what we call traditional labor relations discussions. In other words, we go beyond the mandatory subjects of bargaining, wages, hours, and working conditions, and certainly we had a lot of those to deal with in the COVID-19 pandemic. But we go beyond that to partnering with our management partners to talk about patient care and operations and business planning. And so all of those relationships and those practices put us in a good place to try to confront the COVID-19 crisis together in partnership. And these are just some of the forums. There were national labor calls, typically twice a week, with a very wide audience. Usually as many as 100 people from different labor unions. All unions would be invited. And as the very senior Kaiser executives, Permanente executives, were on those calls and were taking questions. So there was an ability essentially for any labor leader to directly raise an issue or ask a question and get updates from the very top leadership of the organization. And then I think what was more probably unique as a result of the partnership is that through that, we worked out that labor leaders would be invited to the actual operational calls and meetings where things were going on. And this was so many settings. So for example, in Southern California with the Alliance, we had 2 people on the Southern California Regional Command Center call, which was a daily call. And they were on there with all the executives of the different hospitals and medical office buildings and medical groups every single day. And then that trickled down into command center calls that the individual hospitals would have, and labor leaders were also invited to those. And as there were dedicated calls set up for specific things like surge planning, people were also invited to those as well. Next slide, please. So I think we'll, hopefully get into this more in questions, and I want to leave time for that, so I'll just be brief on this. In terms of what went well, obviously I've already highlighted, I think, that our practice of including union leaders in operational discussions. It was a little bumpy to make the transition to how would labor be engaged in these operational decisions, and it was uneven. So there were some regions or hospitals where people were fully involved. There were others where we had challenges and we had to escalate that, but we were able to escalate that, and that's the key part, is we were able to call out, well, here's a hospital where they haven't reached out and included labor, or here's even a whole region, and get the national leadership to intervene on those operational decisions. The other thing is a lot of these discussions are really clinical, and so having the professionals, the caregivers engaged was really helpful in terms of the practicalities of these things. There was a ton of communication. There was joint communication that we did. Also, management did a lot of its own communication as well as labor. And then we were able to work out with management some benefit enhancements. I think Dennis may talk a little more about those later. Absolutely, one of the biggest challenges for us, like all healthcare workers, was PPE. Tremendous frustration, tremendous concern. The guidelines had to continually be evolving. It felt like they were changing almost every day as we were trying to deal with new situations, shortages that would pop up in different kinds of equipment. And obviously Kaiser has a very extensive supply chain operation and procurement. So I can only imagine what this would have been like with other employers, but it was certainly probably the biggest issue of concern to our members was trying to work that out. And we didn't always see eye to eye. We had some differences of opinion on some of those issues, but we were able to keep a good dialogue. And we were able, again, to work out the benefits enhancements. It took us a while to get those sorted out. And they weren't perfect from our perspective, but we certainly appreciate the value of those benefits at a time when other people are being laid off. So I will stop at this point, and hopefully we'll be able to come back to this with questions later.
Thanks, Hal. And as you indicated, the discussions continue. We have our next call noon Pacific Standard Time today. So I just want to quickly talk a little bit about how Kaiser Permanente responded to the crisis. And of course, it was multifaceted, and as you might imagine. So of course, our first priority was to ensure that we had enough care providers to meet the expected patient surge and to make sure we had the space to care for the expected patients. As of April 15th, we had about 9,500 confirmed COVID-19 patients being served by Kaiser Permanente. We know that number is going to grow. Even as we shelter in place and we're starting to relax those rules, the curve has flattened a little bit. We're still ready for an uptick in patients. A quick note on expanded space. Kaiser Permanente, like most healthcare systems, we canceled non-emergency admissions, slowed down and canceled medical and surgical procedures that weren't of an emergency kind of nature. And we took that space and we basically reusing it for intensive care units. We also have been looking at some of our office space and administrative space to determine if we can use any of that area for patient treatment as well. We're working with state and local governments and other healthcare providers to provide space and plans for an uptick in COVID patients as we move forward. And plans like this, they come with additional staffing needs. And that's why KP and our unions have collaborated on temporary staffing plans that emphasize flexibility in scheduling and the deployment of workers. The organization has also had to respond to the tremendously difficult situation many of our valued employees were in as they tried to bridge between professional commitment and personal needs. So we established additional temporary benefits and set up a new call center specifically for our employees to connect to a range of support and benefits. Next slide, Adrienne. So needless to say, senior leaders at Kaiser Permanente and with all of our unions got together, and we came up with different ways of handling scheduling and redeployments. Listed here are some of the things that we did. I'm going to speed through some of this so that we can give Peter time to talk and then have time for questions and answers. Next slide. So the last thing I'll talk about is a lot of employers did things for frontline employees to try to make it more comfortable for people that were going in and addressing the needs of patients. And here's a list of some of the agreements that we made with our unions around immediate help for healthcare workers. So providing up to 80 hours of additional paid time off if they're affected by COVID. The thing that's getting the most utilization at this point is the child care grants. We're spending a lot of money each month to make sure our employees have someone watching their kids as they come to work. We also provide short-term housing, so some people are working double shifts and they have sick people at home. So we provide housing for them in those instances. But the child care grant is the thing that's getting the most activity at this point.
What are you doing down there? Hmm?
Somebody's not on mute. As I said, we opened up a call center for our employees so that we can provide support and care to them. We call it Here For You, and it provides these kinds of supports for our frontline workers. Next slide. So we're going to do questions at the end. So I'll turn it over to Peter at this point.
As everyone's heard, it's pretty impressive what the partnership has accomplished and is working towards. And I just want to thank Paul Clark for organizing this important webinar. My comments are going to be focused on how the pandemic is playing out as what I would say is a call for action in ways that have not been possible in the past. Not even 2 months ago, interventions that may be now possible have become, I think, very an important outgrowth of what's going on. In a recent article in New Yorker, the pandemic was exposed as the major flaws of our healthcare system. The author commented that it's really a stress test, a biopsy, a full body CT scan is quite accurate. He then comments, medicine needs to do more than a recovery. It needs to get better. And so I'm going to try to talk about how we might leverage this opportunity, not just for labor management partnerships, but what I will call collective action. And I'll just use 2 recent articles to give some background to this. In early January, Steve Chartel at the School of Public Health did a blog on Commonwealth, the Commonwealth Fund, saying that questioned whether U.S. healthcare system reform is not yet at a tipping point. This was, in early January. By March 26th, David Blumenthal comments from the Commonwealth Fund, when it's all over, will our healthcare system be different? So my remarks will be focused on possible labor management and collective actions in all sorts. Might be an appropriate response to what's going on with the pandemic, but also talk about our delivery system. I will also say that one of my key philosophers, Warren Bennett, made a comment a while ago saying, when the tide goes out, you discover who's been swimming naked. And I think the tide's out. So let's talk about the pandemic. And I just want to build off what Hal and others talked about, that, and Dennis and Jim, that's going on at Kaiser. One of the things that is emerging from what's going on around potential for collective action and labor management partnerships is the importance of having safety committees, patient safety committees that really deal with the current problems of PP, protective personal equipment, and the dispersing of it. One is the whole question of the availability of it, but also I also want to comment on the fact that the lack of available masks on a national level. And so one of the innovative collective actions that has started in Oregon is the potential converting of manufacturing plants to actually make masks. We are going to urgently need masks for serving our patients on a national level. Interestingly, the New York Times mentioned yesterday that it's not just the masks that are going to be needed, but vials and syringes for the actual vaccine that will be produced. And at this point, there's been no real major effort to start thinking about how we're going to actually provide our vaccines to people who need them. So one suggestion I have is that these committees, whether in place is a labor management committee, or if in fact there's no labor management committee, there is the ability to leverage the current situation. And I'll give you another example. In Massachusetts recently, where I live, we had a hospital that was not providing protective equipment to both physicians and nurses and environmental service workers. They also had a bizarre perspective that people should take their sick days and vacation if they thought they were sick. This is a hospital policy. Only by the actions of the nurses and the nurses union in Massachusetts and the community were they able to reverse these issues. So this is not just pie in the sky. There is really opportunity for doing this. I want to leave some time for questions, but I do also want to talk about the systemic problems of our healthcare system that the pandemic has revealed, but maybe it's an opportunity to take advantage of the current tipping point. Rather than just leaving these systems to be status quo at the end of the quote of the control of the pandemic. So the two areas I want to talk about are system changes and the issue of the morale of staff. So in terms of system changes, go back to Steve Chartel and David Blumenthal, I'm sorry, at the Commonwealth Fund. This is an opportunity when we finally get the pandemic under control to say, what are the systems that we need to create more integrated care, such as what goes on at Kaiser. There are very few hospital systems that really have honored the importance of integration and coordination of care and community support for that. There's been a process, slow but steady, to try to convert outpatient clinics and private physician facilities to more patient-centered medical homes or homes in general. I see this as an opportunity at the end of the current crisis to ask the questions about what is needed to secure a delivery system that really is going to be not only prepared, but providing better patient care on a regular basis. Frontline staff are going to be needed, not just management. It's clear at Kaiser, it's been clear at LA Department of Health Services that without the frontline staff, the kind of transition or transformation is just not possible. I also will make a comment, and I'll come back to this at the end, that this means that labor management partnerships, the way they're structured now, will need to move away from unit-based teams, and I know this will be controversial, to more system and as Hal said, operational issues. This will enable the transformation that I'm talking about to be possible in the future. The second line of opportunity or initiatives is what people are calling moral injury. Moral injury is when you've been asked to do something that you really doesn't fit with your moral compass. And a lot of people talk about healthcare workers being burnt out, but there's an increased rephrasing of that situation about the fact that physicians and nurses, particularly nurse practitioners, are being asked to do things that they don't feel comfortable being told to do. And the two areas that come are articulated are the areas of electronic medical records that tend to be more for billing purposes rather than clinical discussions, and this has been well documented. And the second area has to do with the need for volumes of patients to keep up what's going on. So here's another area that may be actually more fine-tuned in terms of changes going on. System changes, such as changing delivery systems, are pretty difficult and take quite a while. But the attack on, or the ability to modify electronic medical records to make them more clinically useful is possible. It's interesting, just one digression, that recently in New York State, Governor Cuomo has created an executive order eliminating the need for documenting patients during the COVID pandemic if they're doing procedures that are appropriate. His comments were that a person acting reasonably and in good faith under the provision shall be afforded absolute immunity from the liability of what they're doing. So it's not just the healthcare field that is trying to figure out solutions to this. Even the governor of New York is doing this. I will then just end with that. I don't see this happening on a national level, some support for the kinds of activities that we're talking about, but I do see that potentially there's a national level intervention that might be possible after the elections. There used to be a Bureau of Labor Management Relations and cooperative programs. This was in place in the 80s and 90s to help labor and management figure out how to start pursuing new forms of working together. And I would suggest that, among other things, this might be a practical solution to trying to set the tone for these activities and provide technical resources and possible funding.
We're going to have to move to questions, Peter. Or can you wrap up?
I will just say that I think that we have a chance of creating collective actions now to take advantage of the magnification of what's happened. Do we have the will to do this? Is my question.
Okay, well, thank you, panelists. We're going to move to questions now. Let me pose one that has come in. How did Kaiser Permanente and the Alliance deal with the issues of time, the pressure to move fast on all the pre-surge planning versus the time that it takes for labor management collaboration? If Dennis, Jim, or Hal want to respond.
So my response would be, you know, we talked about that weekly call that we had with labor that started out as a bi-weekly call where we would bring up all kinds of issues that we had. And then on a regional level, people actually got together, management and labor, physicians, hospital administrators, to talk about the things that we needed to do. And I'll just say it was real-time, just-in-time conversations that allowed things to happen. I've never actually negotiated anything as fast as we did around the enhanced benefits. We negotiated with a number of our union partners and non-partners, and we basically did it over a weekend. And by the next week, we started putting all these things in place. So that would be my response. Hal, Jim, I don't know if you want to add to that.
I can add to that. I think the key in terms of expediting the time frame was what I alluded to earlier about labor being directly involved in the operational meetings, right? So if you're in a traditional labor relations environment where management has its meetings and then they come later and they meet with the union and then they go back and it goes back and forth in a sort of bargaining traditional environment, that would be very difficult to make the kind of rapid changes that we're going on. So by having the union leaders like directly, let's say you're in, a service area with a hospital and medical office building, you're right on the call where they're talking about, well, these medical office buildings are going to close and these employees are going to have to be relocated to this other place. And so you're engaging in real time. Now, a lot of that was just information sharing at these command center calls, but then the union leader at that level, without it having to rise all the way up nationally and back down again or schedule some meeting, can pick up the phone and say, well, here's the concern that's going on. If you're going to be moving these employees from here to here and putting them in this department, here's how we need to address that. So I think it forces you to move faster. It forces you to integrate labor more directly into those operation discussions if you want it to work. I would also say, people were working, 12-hour days, 7 days a week. I mean, we were having calls all the time. So that was part of that we dealt with it. We just put together a lot of conversations on an ongoing basis.
Well, thanks for that. We have another question that asks about whether the partnership has had discussions about employee testing and contact tracing of employees. Has that been an issue that the partnership has dealt with?
Yes. The testing guidelines of employees have sort of evolved over time. With our as we all know, there hasn't been enough testing capacity in the country. Similarly, initially, Kaiser Permanente had a pretty restrictive testing of employees only for the more symptomatic, serious symptomatic cases, and that was of concern. And we have been urging Kaiser to expand the testing more broadly among employees, and they have been doing that as they've developed capacity, and everything from building new labs, increase testing capacity, to expanding contracting with outside vendors. Contact tracing, we have not talked about as much.
And I think the other thing I can add, I believe we're opening a new lab very soon that will be able to accommodate more testing. So,
okay, there have been a couple questions, and maybe I can summarize them with this question. Labor management partnerships in healthcare have been around for a while. They've had a lot of success. But few health systems, few hospitals, really relative to the number out there, have adopted this approach. Why is this? What are the hurdles, the challenges that we don't seem to be able to get over to make partnerships more widespread?
yeah, I'll take a crack at that and say, first of all, as far as I'm concerned, it's difficult. This is not easy work, and it requires you to be open. It requires you to trust each other. It requires you to provide data to people around issues that are in front of us. And so it's a lot of work to make a partnership work. I got to throw a bone. Tune in to my presidential address, because I'm going to actually be talking about that question in the 72nd presidential address. But it's not easy to do this. It's very difficult.
I wouldn't add to Dennis's answer because I think it's complete, but I'd add a thought. The thought is this about the question itself. For me, it's probably the most important question in the labor movement. I'm a manager. I'm not part of the labor movement, but having worked with unions and studied them and supported card count processes and hoped for their success, the question that has been asked here as to why our model, in some variation, it should not be copied, but why hasn't our model been followed and lasted longer? I don't have an answer other than what Dennis gave, but it is the question for the labor movement I humbly submit from the outside.
Peter, do you have any thoughts on that? You're muted.
The additional thought, building off of the two last comments, is that when it's worked, it's taken labor leaders who have a perspective that this is union building as well as patient building. And that when that kind of linkage is made, there have been labor leaders in SEIU, in shared union, the AFT, who have taken on this and seeing this as benefiting their rank and file members, and as a result also having increased better, if not excellent, patient care. And you know, I think that's again a call for action that I'm suggesting is one of the positive outcomes of this pandemic. If we can get other labor leaders to stand up and understand that this is actually going to benefit everyone, including the community, then we might have more partnerships. I would agree with Dennis, it's a tough thing to do, but the question is, how do you get them started? And I think it starts with labor leaders and some progressive managers who see the benefits of what's going on and look towards not just healthcare, but other industries that have been successful.
Just to explore that a little bit more, you know, it's clearly the case that on the management side, that schools of management, hospital administration, healthcare administration seem to teach more of a command and control approach to leadership and management. I doubt that very few schools promote the idea of participation and engagement when they're developing new leaders for the field. Is that the case, or do you have some comments about that?
I would say that it's not only there, but also, you know, there's a lack of that education in medical schools and nursing schools and public health schools, where there are other leaders that are coming into the healthcare field. And we need to, you know, alter those opportunities, but most business schools and even schools of public health don't even talk about this issue as an alternative to what's going on. It might be something that they would find of use to think about.
Hal, what do you think, given your experience from the union side?
Well, I think I'll speak to what it's like from a union environment. You know, it is clear to me, and I've been in, you know, very traditional labor management relations as well as in the partnership. It is clear to me that when you look at the results that have been achieved for unions in partnership and their union members, there's no question that this is an effective strategy in terms of pay and benefits, even in terms of what we were just talking about. You know, you see healthcare employers all across the country laying people off right now. We have not done that with Kaiser Permanente. We have redeployed people to other needs, so they've remained employed, even if they're off their medical office or their department shut down. So it's clear to me that it is something that produces really good results for unions, just on traditional measurements of pay and benefits and job security, as well as the intangible of giving people a voice in the job and the working conditions. At the same time, it's not easy because, and it requires a lot of very strong and skilled leadership from particularly local union leaders and shop stewards and others, because it is always easier in a labor management environment to, you know, blame the other party when there's a problem, right? Instead of trying to solve and own that solution. And we see that behavior both on, you know, some union leaders and some management leaders. It's easy for a manager to say, well, I could only do this if those unions would let me do it. And the unions are standing in the way of me meeting my goals. And unions, it's the same. You can say, well, look, management did this horrible and that horrible and so forth. So it takes a different way of interacting that, as Dennis said, is harder for both the management and the labor partners than a traditional environment where you can just take your position and say, this is it, this is our demand, you're wrong, we're right. And what I would say to both management and labor is that it's harder, but it's worth it because the results that you get are better, including operationally for management as well.
To get another perspective, I'm kind of going to put Janet Wilder on the spot. We've had a request from a couple of participants for her to just say a few words about her partnership in Massachusetts. Janet?
Sure. Hi, everybody. So I represent speaking for the Share Union, we represent about 3,000 healthcare workers at UMass Memorial Healthcare in central Massachusetts. We have a labor management partnership. Some of my management colleagues are on this call too. And in some ways, there are a lot of parallels. We've used Kaiser as a model. I think that unions need to come to partnership from a position of strength, and that a lot of unions are suspicious of partnership because they think it's a sign of weakness, and that what the benefits that Hal was talking about are absolutely deliverable as long as you're a union that's talking to all your members and engaging all your members and working with management from there. In terms of our experience in this COVID reality, I would want to say that our partnership is less mature than Kaiser. So for instance, in the beginning, when management felt the need to close some things and redeploy people quickly to other areas and do the planning for the surge, they were very much in a like, we got to do this now. We don't have time to sit down and talk with the union. And so, but now that things have gotten a little bit rolling, we've set up a variety of mechanisms to be engaged and working on figuring out how to do things together. So we have a problem-solving group around the labor pool. These are people who've been told, we don't need you here, but we do need you over here. And you can imagine all the many different kinds of issues that raises. We're having daily update calls with the command center, especially around issues of PPE and infection in areas. We have an emergency task force meeting that's dealing with kind of the bigger issues. Now we're talking about how do you reopen, how do you move people back slowly, dealing with the social distance and all of those issues. It's an incredibly intense time for frontline workers. It's just you know, completely overwhelming in some ways. But we are figuring out how to do this together. And even though the employer moved in the beginning without union participation very much, they were making pretty pro-union discussions and keeping everybody on the payroll. So give them a lot of credit for that. I don't know if Bart Metzger wants to speak up from management side on about our partnership.
Yeah, can you hear me?
A little bit.
So a couple of things. First of all, it's hard to compare Kaiser with UMass Memorial. This being the share relationship and our journey into a collaborative paradigm is still very, very new, and we kind of fall off the wagon every once in a while and revert to tradition. We are trying to proceed on the premise that there is no business case for adversarial labor relations. Joel, Janet have heard me say this ad nauseum. The problem is that when there are crises, we sometimes have difficulty getting leadership to accept the premise that they're part of the equation. So we're making progress. It's very much like building a building one floor at a time, but we're committed to seeing this through, consider it to be the only way that we can push organizations such as ours forward. And we're just not going to give up.
We have a comment from Zach Zobrist, who's on the Penn State faculty and is a former SCIU staffer who's worked a lot on partnerships. And Zach says, just imagine if we had formal union labor management partnerships at every health system in the US, how much more coordinated and effective the response could be. And not just in hospitals. Zach's had experience with such programs in nursing homes. And he thinks that those partnerships are dealing much better with the problems they're facing because of their partnerships. I'm going to ask the participants to make some closing comments in a minute, but let's just take a couple more partnerships, questions. From a practical perspective, is partnership better for the financial needs of hospitals and patient care scores, as well as, of course, for staff?
So the way I could answer that is by saying, for the last few years, Kaiser Permanente has been, very successful. We're a not-for-profit, so half of our proceeds go to community benefit, which is a good thing. Our company has grown, our membership has grown. We've been able to provide our health care to more and more people every year. We provide great benefits and wages to our employees. In the last decades, our unions have grown by 30 to 40%. Our employees are engaged. We find that through our unit-based team structure, we get better performance, better quality, better patient satisfaction, utilizing our partnerships and teams. And so when I look at everybody that participates in partnership, the employer, financially, customer service-wise, membership-wise, productivity-wise, when I look at unions and union growth, when I look at employee job security, employee wages, employee benefits, all I see is positive, but that's just me.
I have Jim Pruitt. I have nothing to add to what Dennis said, but Professor Clark, since you did say there'd be last minute comments, let me make mine so you don't have to come back to me.
Sure.
I heard you cite your faculty colleague, Zach, a moment ago, and I want to commend all the work he's done in Pennsylvania with SCIU and the nursing homes. And I met Zach through John August on the Cornell faculty, and Kaiser Permanente, yeah, we're doing real well. And we could learn a lot from the work that Zach did in Pennsylvania with his colleagues and the managers there. That's all I've got. Thanks. I agree with Dennis.
Hey, Jim, one more comment. I got to say hi to Lynn back there in the background.
Hal, do you have a closing comment?
Yeah, I just want to say, I know this is a wide audience. We've got management people, we've got academics, we've got other union folks. And I think we, speaking for the Alliance, and I think also for Jim and Dennis, we believe that the partnership at Kaiser Permanente has real value for a model that other unions and employers can look to. We do know that there are some unique features to Kaiser Permanente, and it's not going to be a cookie cutter approach to just copy it. But as Dennis said, it really has been successful. And you look at the 20 plus years now of labor management partnership, and you can compare it to the time before there was a labor management partnership, and you can see that the performance, for a variety of reasons, on any measurement from a worker perspective or a management perspective, has been better. And we just want to extend the invitation really for any management or union groups that are interested in learning more about it. A lot of our stuff is online and not behind any kind of firewall. And we're happy to have individual conversations as well and do presentations like this or targeted meetings. Because it's hard, it is a challenge, but we think it really brings a lot of benefits and we're happy to share.
And then I just want to add one other thing, Paul. You talked about what people are teaching in universities and do they teach partnership. And I just want to say, so every year I get an invitation from Brandeis University to come and speak to students. That's the only school that's ever asked me to speak on partnership. And as Hal said, that is something that I, and Jim would do at any time, whether it's a university, an employer, a union. We are always open to at least give our experiences to people, good and bad.
Thanks for that, Dennis. Peter, do you have a 1 minute?
Yeah, I would just say that, building off of what Bart and Janet said, that, it's a time for building blocks to blossom now, both to deal with the covert situation and post pandemic. And I'll also say that we need research. That's another piece of this puzzle that maybe will help initiate and encourage people to do it. More research is needed to track and monitor what we're doing so that we can really talk about this in the future, where we have more than Kaiser as examples of great work.
And Dennis, as national president, I thought we'd give you the last word.
Well, I just want to thank everyone for joining us. This has been a great conversation. Thanks to all the speakers. And Paul, thanks to you for leading us through this conversation.
Well, it's been my pleasure. Two little commercials here. LERA does have interest groups, and this webinar has been sponsored by the Healthcare Industry Group. If any of you are interested in being involved in that group, we organize a couple sessions at every national meeting. If you're members of LERA, you can just go in and under your profile, you can join the Healthcare Industry Group or any of the other industry and interest groups. And lastly, I'd like to encourage you to participate in future webinars. There's one this afternoon on the media. There'll be regular ones on Thursdays, I believe, in the next several weeks. They've proven to be very popular, and kudos to the folks who have organized this, Emily Smith and Joel Kucher-Gershenfeld, and the people who have worked on the individual webinars. We hope to see you at future programs like this. Lastly, I apologize to the folks whose questions I didn't get to, but we are at the appointed hour. And with that, I'll bid everyone goodbye for the moment. And thanks for coming.
Thank you.
Thank you.
Thank you all.
Thank you.